Hello, I'm Professor Belinda Beck, bone researcher at Griffith University and the founder of Oneuro. In today's video, I'll tell you the background behind the Oneuro program and what makes it an effective therapy for osteoporosis, a condition of very much reduced bone mass that increases the risk of fracture from minimal trauma. Bone is clever in that it adapts to the loads it routinely experiences. It gets lighter if loading is reduced, such as when we go into space or on bed rest, and gets bigger and stronger if it's loaded over and above regular activity, such as during intense exercise or heavy occupational activity. Over the years, first animal research, then human trials, have examined the types of loads that bone responds to most or least. Strain is a measure of deformation of something under load, including bone. Animal studies show that bone adaptation occurs with a clear dose response to strain, meaning the greater the strain, the more the response, and vice versa. Bone also responds preferentially to strains that are induced quickly. Translating those observations to potential exercise recommendations for osteoporosis, we find a catch-22 situation. We know that rapid high-load activities can be dangerous for people with very frail bones. For this reason, decades of clinical trials tested low-intensity activities like walking, dancing, swimming, tai chi and yoga as therapy for osteoporosis in order to avoid causing fractures. Perhaps unsurprisingly, based on what we know from animal research, those activities were found to not increase bone mass. Even energetic gym workouts at best only prevented age-related bone loss. Mind you, most regular weight-bearing exercise will help to prevent falls, which are a primary cause of fragility fractures, so doing low-intensity exercise is not bad for bone per se, it just won't build bone. In fact, until relatively recently, nobody had actually tested whether high-intensity exercise would be safe for people with osteoporosis, and this left a knowledge gap. The LIFTMORE study, led by me and my team in 2014, took the leap to examine the effects of heavy lifting and impact exercise in postmenopausal women with osteoporosis and osteopenia. Specifically, we tested the effect of 30 minutes of resistance and impact training twice a week for 8 months on parameters of bone strength, falls, and other fracture risk factors such as lower extremity function and posture. We found this exercise program not only dramatically improved bone, muscle and function, but the program was safe when supervised. This was a step change in thinking about exercise therapy for osteoporosis. We repeated the LIFTMORE study in older men with low bone mass in the LIFTMORE-M trial and found essentially the same thing. Because heavy loading and impact will always carry inherent risk for people at increased risk of fracture, supervision of our program is vital. For this reason, and to facilitate ongoing monitoring of the effectiveness of the high-intensity resistance and impact program in the real world, in 2015 I founded the Bone Clinic in Brisbane, Australia, and rolled out the program now known as Oneuro. The Bone Clinic is a translational research clinic where Oneuro is delivered safely and effectively by qualified exercise physiologists, and we continue to collect data on client outcomes. The MedXOP trial conducted at the Bone Clinic compared 8 months of twice-weekly Oneuro with a low-intensity Pilates-based program called Buff Bones in postmenopausal women with low bone mass. The Oneuro group improved, just like in the LIFTMORE studies, whereas the Pilates group lost bone. In 2018, to improve access to Oneuro for people who didn't live near the Bone Clinic, Oneuro was licensed. Now, exercise specialists around the world can also deliver Oneuro to their clients with poor bone health. If you are an exercise practitioner and wish to deliver Oneuro in your practice, please visit the Oneuro Academy for information or email inquiries at theboneclinic.com.au. If you're a clinician wanting to refer your patients to an Oneuro provider or a patient interested in exercise therapy for osteoporosis, please visit the Oneuro location map, navigate to your vicinity and click on the locator tags. If there isn't one near you yet, feel free to share this video with your local physiotherapist or clinical exercise physiologist in case they're interested in becoming licensed. Make sure to like and subscribe to our YouTube channel for more videos and click the bell icon to get notifications.